Thank you for joining us today. My name is Phil Goglas, and I work here in Washington, D.C. on behalf of the Interstitial Cystitis Association. Today, I wanted to talk to you about how the federal government works. The federal government is broken down into three branches. You have the executive branch, which is the administration. They enforce the laws. You have the judicial branch, which are the courts, and they interpret the laws. And then you have the legislative branch, which is Congress, and they're the ones who create the laws as well as specific policies. Now, many of you may ask, with our advocacy on the federal level, why do we just engage with Congress? That's a good question. The reason why we engage with Congress is because they have the unique role to create laws, create specific policies. They have the power of the federal purse strings. They decide how much each federal agency receives in funding on an annual basis, and they have specific oversight over federal agencies. The reason why we advocate with them as well is because the decisions that Congress makes are based on a member-driven process. So members of the House and the Senate hear from their constituents, which are you, about what key priorities they have and what they should be as members supporting. So we very much focus on educating members of Congress about the important needs of the IC community, what our funding recommendations are to ensure that there is quality research and other activities that are supported.
IC research is so important to all of us suffering from this disease. There's been a better understanding over the years about IC, but we still have a very long way to go before we have better treatments and hopefully someday a cure for this disease.
IC awareness matters because it gives us the opportunity to not only educate, but to empower others about our disease. The best people to create awareness are those affected by the disease directly, whether it's patients, family, doctors, or other advocates. It gives us the ability to give others hope and give them the opportunity to not only share our stories forward, but then share their own.
Raising awareness about IC is a key to getting more research studies funded, to getting more healthcare providers knowledgeable about this condition, and also help friends and family, loved ones of people who have this disease understand what it's like to live with a condition such as IC. IC patients really need to not be afraid to speak out.
IC awareness is really important at multiple levels. You have the patients and their loved ones who need to know what's going on so that they can advocate for themselves and understand what this condition is that they have. Awareness is really important also for medical professionals. Not all medical professionals have heard of IC. It's important for them to understand what IC is, how it affects patients, so that they can be compassionate caregivers and not feel that this condition is all in somebody's head. Awareness also matters at a governmental level, whether that's Congress in appropriating money that can be used for research or used to develop treatments. It's also important at the National Institute of Health and the Centers for Disease Control as they allocate research dollars and help on the research front. So awareness matters really at multiple levels.
In Congress, you have two separate chambers. You have the House of Representatives and the U.S. Senate. The Senate is comprised of 100 members, 2 from each state. So it doesn't matter if you are a high population state, such as California, Florida, or New York, or a low population state, such as Delaware or North Dakota or South Dakota. Each of those states has the same number of senators, being 2. Each Senate term is for 6 years. So every senator has a 6-year term, meaning that every 2 years, only 1/3 of the Senate is up for election. On the House, however, there is one individual member for each congressional district. Those congressional districts are 435 in total. And what decides how many members each state has is the census. So this year, we are going to see some new additions to some House seats, such as Montana is getting an extra seat, while other states, such as New York, are losing a seat because of the change in population. So the House of Representatives, they are elected every 2 years to a 2-year term. They each represent a single congressional specific district, and how those get allocated, of course, is on population. So states such as Texas have a lot more members of the House of Representatives than states like North Dakota or South Dakota or Delaware, because there are more people who live in Texas than they do in those other states. Now, in addition to Congress being separated by the House and the Senate, each side, the House and the Senate, both have key congressional committees that we work with to advocate for our key priorities. On the Senate side, you have the Appropriations Committee. They are the ones who are tasked with deciding how much federal funding each agency receives on an annual basis, as well as some key recommendations about support for critical programs or how money should be allocated. You have the Health, Education, Labor, and Pensions Committee, which is appropriately the Health Committee. They have oversight over a large number of healthcare issues. They have specific oversight over NIH, which is the National Institutes of Health, the CDC, the Centers for Disease Control, specific drug policies. And we interact a lot with the Health Committee because of chronic pain issues that are advanced through the Health Committee and are debated in Congress. You also have the Finance Committee on the Senate side, which oversees Medicare, Medicaid policies, as well as being the Chief Tax Committee on the Senate side. They have important jurisdiction over healthcare matters as well. On the House side, you also have the Appropriations Committee, which again is comprised of members who decide how much allocation is funded for each federal agency and specific programs. You have the Energy and Commerce Committee on the House side, which is the complement to the Health Committee. They have oversight over healthcare policies, as well as advancing key legislation through the process, including chronic pain priorities and legislation. And then you have the Ways and Means Committee, which is a complement to the Finance Committee on the Senate side, which oversees Medicare, Medicaid, tax policies, and also healthcare, key healthcare areas. Now, we engage with all of these committees on the House and Senate side because of the important role that they play. For the Appropriations Committees, each side determines how much money is spent at the National Institutes of Health, for the Centers for Disease Control and Prevention, and decides how much money is supported for Department of Defense activities, in our case, which is the Peer Reviewed Medical Research Program. So it's critically important that everybody engages with their members of Congress, even if they're not on a committee of jurisdiction on the issues that we work on, because again, it is a member-driven process. Members of Congress rely on hearing from their constituents about what's important in their home district or their home state and what they should be working to advocate for here in Washington, D.C. And again, why do we interact with some of these key committees? We have the direct oversight of federal agencies and the power to fund them. So there have been many times where we've worked with key champions on the House and Senate Appropriations Committee to grow our IC education and awareness program at the Centers for Disease Control and Prevention, as well as include key recommendations about how to advance that program forward and to make sure that it is functioning to the best of its ability for us to achieve the best possible results. How that comes about is working with our champions and influencing the process for more funding for research or for a specific program. I briefly mentioned the Peer Reviewed Medical Research Program. At the Department of Defense, there is a dedicated program that is funded and oversees medical research into conditions that are related to military service. Interstitial cystitis has been fortunate enough to be listed as a condition eligible for study in previous years. And because of that, we have had a lot of important research that's been funded. We continue on an annual basis to engage on the PRMRP, the importance of it to members of Congress, and the great work that has been done for the IC community.